Cetirizine, also known as Zyrtec, is an antihistamine that is used to relieve allergy symptoms such as watery eyes, runny nose, itching eyes and nose, sneezing, hives, and itching. It works by blocking a certain natural substance, histamine, that your body makes during an allergic reaction. It does not prevent hives or treat serious allergic reactions. If your doctor has prescribed epinephrine for allergic reactions, always carry it with you and do not use cetirizine in place of your epinephrine. The recommended daily dosage for adults and children over the age of 6 is 5 to 10 mg once a day. It is best to take cetirizine at the same time each day, either in the morning or in the evening, as it can provide relief for up to 24 hours. Always consult with your doctor before taking any medication. Before taking Zyrtec, it's important to read all the directions on the package. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, take it as directed, usually once daily. If you are using the chewable tablets, chew each tablet well and swallow. If you are using the rapidly dissolving tablet, allow the tablet to dissolve on the tongue and then swallow, with or without water. If you are using the liquid form of this medication, measure the dose carefully using a special measuring device/spoon. Do not use a household spoon because you may not get the correct dose. The dosage of Zyrtec is based on your age, medical condition, and response to treatment. Do not increase your dose or take this medication more often than directed. If your allergy symptoms do not improve, or if your hives do not improve after 3 days of treatment, or if your hives last more than 6 weeks, it's important to consult your doctor. Additionally, if your condition worsens or if you think you have a serious medical problem, such as a very serious allergic reaction/anaphylaxis, seek medical help right away. Some common side effects of Zyrtec include drowsiness, tiredness, and dry mouth. Children may experience stomach pain as well. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. If your doctor has prescribed Zyrtec for you, it's because they have determined that the benefits outweigh the potential side effects. Many people who use Zyrtec do not experience serious side effects. However, it's important to contact your doctor if you experience difficulty urinating or weakness. While rare, a serious allergic reaction to Zyrtec can occur. Seek medical help immediately if you notice symptoms such as rash, itching or swelling of the face, severe dizziness, or trouble breathing. This is not a complete list of potential side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. In the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. Before taking Zyrtec, it's important to let your doctor or pharmacist know if you have any allergies to cetirizine, hydroxyzine, levocetirizine, or any other allergies. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. Before using Zyrtec, inform your doctor or pharmacist about your medical history, especially if you have difficulty urinating, kidney disease, or liver disease. If you are using Zyrtec to treat hives, it's important to tell your doctor right away if you experience hives that are an unusual color, look bruised or blistered, or do not itch, as these may be signs of a more serious condition. Zyrtec may cause drowsiness, and the use of alcohol or marijuana can increase this effect. It's important to avoid driving, using machinery, or anything that requires alertness until you can do it safely, and to avoid alcoholic beverages. It's also important to talk to your doctor if you are using marijuana. Liquid forms of Zyrtec may contain sugar, so caution is advised if you have diabetes. It's important to ask your doctor or pharmacist about using this product safely. Before undergoing surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. During pregnancy, Zyrtec should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. This medication also passes into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware of any potential drug interactions that may affect how your medications work or increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Don't start, stop, or change the dosage of any medicines without your doctor's approval. If you're taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants or other antihistamines, it's important to inform your doctor or pharmacist. Also, check the labels on all your medicines, as they may contain ingredients that cause drowsiness, and ask your pharmacist about using those products safely. Avoid using Zyrtec with any other antihistamines applied to the skin, as it may cause increased side effects. Additionally, do not use Cetirizine with medications similar to hydroxyzine and levocetirizine. It's important to note that Zyrtec may interfere with certain lab tests, potentially causing false results. Make sure that lab personnel and all your doctors are aware that you are using this medication. If someone has taken too much Zyrtec and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. You can call 911 or your local poison control center for assistance. Symptoms of an overdose may include severe drowsiness, and in children, there may be mental or mood changes before drowsiness sets in. It's crucial to seek help right away in these situations. Make sure to keep all your medical and lab appointments to ensure that Zyrtec is working effectively for you. This will also help your doctor monitor your progress and make any necessary adjustments to your treatment plan. If you forget to take a dose of Zyrtec, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Do not take a double dose to make up for the missed one. When it comes to storing your Zyrtec, it's important to keep it at room temperature and away from light and moisture. Make sure not to store it in the bathroom, as the humidity can affect its effectiveness. Different brands of Zyrtec may have different storage needs, so it's best to check the product package for specific instructions or ask your pharmacist for guidance. And always remember to keep all medications out of reach of children and pets. When it comes to getting rid of expired or unused Zyrtec, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, consult your pharmacist or local waste disposal company for the proper way to discard the product. This not only ensures the safety of others but also helps protect the environment. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.